So let's talk about access to health care in the United States. Get your clickers ready. So what proportion of the Americans are uninsured? 30%, 25%, 20%, 15%, 5%. Okay, let's find out how good people are. Well, 39%, 8%, 38%, 13, and 1. So the two winners are either 20 or 30%. Sorry, guys, we're down. So these are the numbers. Roughly 308.7 million Americans. In other words, 310 or 300 million Americans, whatever you can keep in your brain. 40.5 million are elderly, over 65, and insured on Medicare. Why do we count them out? Yeah. That we got universal coverage for people over 65, right? You go over 65, you get coverage. So that we know is 100%. So that leaves, doesn't leave 204. Oh, and then we have 214.4 million who have employer-sponsored insurance. They're students like you. You get insurance through Penn. They're on Medicaid. They're part of the military. They're vets. That's all the insured group. About 170 million of that group is private employer-based insurance. That leaves 53.8 million Americans uninsured. What percentage is that? The problem with that number is it's got undocumented, illegals, whatever name you like to use. People who are not citizens or legal residents of the United States. And that turns out to be 11 million people. Now, you will often hear round numbers, 50 million uninsured. That includes the undocumented. If you subtract that, you're down into the 39, 40, 41, 42 million range. So it's either 50 million or 40 million. It ain't 20%, it ain't 30%, it's 15%. What is another way of understanding that? There's about 255 million Americans have some type of coverage. So think about that for a moment. Lots of talk about the uninsured in America. 85% of Americans have coverage. What does that mean? What is one implication of that? If you're Barack Obama and you're in 2008 and you're running for president and you want to get universal coverage passed, and 85% of Americans have insurance, what does that mean? What does that mean? You're trying to be elected. You need 51% of the vote. Most of the people, and even more than 85% of the people who vote, have insurance. Hard to convince them you got to do something about the uninsured if most of the people you're trying to appeal to already have insurance. It ain't them. It's not for my pocketbook, right? So while among some good liberals like me, you care about the uninsured, most Americans, vis-a-vis them, it's not their issue. Unless, what? That's the 15%. Unless cost, but that's a different issue. We're talking about access. We're talking about uninsured. Unless you're worried you might become one of the 15%. When might that happen? In a recession. And what is happening in 2008? The Great Recession. Okay? But it does create a political dilemma, this number, that you didn't know. And why didn't you know it? Why did you think, or most of you think, that it was either 20% or I think the modal was 30%? Yeah. Exactly. You got to differentiate the frequency of talking from the data. All right. Next question. You already got a cheat here because someone in the corner there began talking on this, and I had to cut her off. What proportion of the uninsured can afford health insurance? What proportion of the uninsured can afford health insurance? 60, 40, 20, 10, zip. Wow, we're all over the place. Nice bell-shaped curve here almost. Okay, there are some of you who believe none of the uninsured can afford insurance. Well, maybe that's true. 60% of the uninsured can afford insurance. So a third of you think that more than half are somehow malingerers, and they don't want insurance even if they can pay for it. That's interesting. 10%, we're all skewed in the middle here, which is a very wide range. What do I conclude from this? What do you conclude from this? You have no bloody idea. All right, let's break down the uninsured according to this graph. Just take the uninsured and look at the bar graph on the right. Now, that is broken down by a mechanism many of you, unless you're hardcore social scientists, economists, and sociologist types, and God save you if you are, by FPL. What does FPL stand for? What does FPL stand for?
Federal poverty level?
Yeah, what is the federal poverty level for a family of four? I'll make it easy for you. Can they afford health insurance? No way. They can barely afford to live. Any of you tried to live on $22,050 for a single person? Yeah, living for a family of four, really hard. Cancel that. Impossible. 100 to 250% FPL. What's that number? 22,002? Very good math. 55,000. Can they afford health insurance? Can they afford health insurance? Why not? 55,000. 4 people? What's the relevant question that I haven't asked? How much does health insurance cost? For a family of 4, how much is health insurance? How much is health insurance? No idea. I could have asked that question. I had thought about it. But you guys don't buy health insurance for families of 4. Almost no one buys health insurance for a family of 4. It's more than 12,000. When we were doing health care reform in 08, 09, it was 12,000. On $55,000 pre-tax money for a family of 4, what are the chances you're spending $12,000 on health insurance? 0. Then we get above 55,000. 55,000 to 400% of FPL, which is 88,000, 89,000 bucks. Maybe. Over 400%. Can they afford health insurance? If they can't, no one can. Only the 1% can. The correct answer to that question was 10%. It obviously is a judgment call, and I gave you my judgment. But it's not me alone. When we get to the Affordable Care Act, you will see that subsidies end at 400%. Partly a political move, partly an economic move. 400% of the FPL, $88,000 a year, is a lot of money in America if you look at the distribution of incomes. We can go into that later. So what I put up here now is a breakdown of, by income, where people got their insurance. And you can see, if you look at poor people, less than 1 in 5 got health insurance through their employer. They work for people, employers, who don't provide health insurance, or they're self-employed in some way, whether it's maids, working small grocery stores. So 46% get Medicaid, but still 36%, a third of them are uninsured. If you look at 22,000 to 55,000, 47% of them are now in employer-sponsored insurance. A lot of them work for this university, whether they're secretaries or others. But still, 27% of those people are uninsured. When you move over to 400+%, it's pretty striking that above 400% of poverty, 5%, 1 in 20 of those people who are by no means in America poor are uninsured. So it's not restricted to the poor, although it's predominantly poor people. Next question, get your clickers out. What does the typical, and by typical I mean modal, that's the most common, even it's not majority, uninsured American look like? A 25-year-old mother of 5 on welfare, unemployed African-American teenager, white working-class adult without children, Hispanic undocumented immigrant, or a lazy UPenn student, 21 years old. So, the typical uninsured in the United States is what you are going to be when you leave college. First of all, a plurality, but not a majority, are white non-Hispanics, 46%. Working, interestingly, most of the uninsured are not unemployed or in family, children, or spouses of unemployed people. 3/4 of them are either children or spouses or the worker, where the worker is actually working. So if you got a friend, as I do, or a relative who has a view of the uninsured are just malingerers, lazy bums, completely wrong. They are working, sometimes 2 or 3 jobs. And why are they uninsured? Their employer doesn't give them health insurance. Or their employer doesn't give their father or their mother health insurance. The most common age, as the woman in the corner said, 19 to 29, where a third, which makes up a third of the uninsured. And of the uninsured, 81%, if you take the 50 million number, 81% are American citizens. It's not the foreigners rushing in to get our health coverage. There's another way of looking at a piece of that, looking at the employed status. So you can see here, 61% of the uninsured have 1 or more full-time worker. 16% have a part-time worker in the house. And only 23% are non-workers. Some of them may be unemployed, some may be children, some may be people who are just out of the workforce. So what you can see here is we don't have a situation in this country, I'll get to you in a second, in this country where most of the uninsured are not at least somewhat gainfully employed. So here's the numbers, and by the way, these numbers are slightly different than the numbers I had shown you before. They rearranged. Not everyone reports it the same way. You can see here, first of all, that among young kids, 0 to 18, not a reasonable uninsured rate. That percentage, by the way, is not of the whole population. That percentage is of the uninsured. So not a big number of uninsured kids. Why is that? So we got 2 public programs, Medicaid and CHIP, Children's Health Insurance Program, passed during the Clinton era that covers children. Not all kids are covered, but most are, and then the rest of them have coverage through their parents' insurance. You can see that a big portion are 35 to 54. If you take 2 decades, you're going to get a big portion of them. Not that many older people getting close to retirement. How long do most people stay uninsured? Is it transient? 2 months, 8 months, a year and a half, 3 years? A year and a half and 1 year are the dominant. Well, here's the number. This is not a trivial problem. For a lot of people, half of the people, it is a long-term problem. Why is that? let's think through what's happening here. What are some of the characteristics you know? We need a remote thing. You know about the uninsured. What happens to the income of people sort of at 100% of poverty? It goes up and down a lot. So, but they might not sprout enough money to buy insurance. Second problem, yes. For some people, it's a vicious cycle. Do you think that's true for half of the people? Remember, 3/4 of these people are already employed. They are working for employers. What do we know about their employers? They ain't providing health insurance. Now, not a lot of them are flipping back and forth between jobs, especially in a kind of recession, right? So you're stuck. You're working. You're stuck with an employer who's not offering insurance. Most employers are not going from the I'm not offering insurance to I'm suddenly offering the insurance mode. Most of them are going, or at least some of them are going from I'm offering insurance and I ain't doing that ever again. It's too expensive, right? So one of the reasons that you've got a big proportion here of people who are long-term unemployed, long-term uninsured, not because they're unemployed. It's precisely because they are employed, but they're stuck with an employer who's not giving insurance, and he ain't hopping into the market. If we had a lot of uninsured because we had a lot of unemployment, right, then once people got a job, you might see a different scenario here. All right. Where are the uninsured? Are they in the red states, the blue states? For those of you who don't know, the red states, those are Republicans. The blue states, those are us Democrats. The big cities, the Midwest, are they in Europe? Where are the unemployed? Uninsured. So where are the uninsured? One of the things a cynic in the White House said about health care reform is that blue guys are passing a law that's going to benefit those red guys, and they don't appreciate it. So why is this so red? Why are the uninsured? They're not concentrated exclusively in red states, but for those of you who know anything about politics, you can look in the Northeast, the most solidly Democratic part of the country, and you can see what? Looks an awful lot like it's the lowest uninsured rate in the country. Why is that? Why is that? Eligibility requirements for Medicaid are set by the states. And you can say, well, everybody who's under 200% of poverty, we're going to enroll in Medicaid. And then what happens? You have to pay more as a state to cover them. Or we could say, if you're an adult, childless, we're not covering you even if you're under 25% of poverty. I think that's Wyoming, which has the worst. So states have a lot of control. And places which don't believe in government solving state problems or don't like the poor aren't going to spend. Did I offend you? It's just acid indigestion, right? They won't spend the money. They'll have restricted Medicaid rules and eligibility, and they will end up with a lot more uninsured. Higher rates of unionization of the workforce. Given the fact that unionization is down around 10%, the variance may not be high enough to figure that out. There is one factor which we haven't gone into, and I think, hold on, I think I'm unlikely to go into, which is which employers provide insurance. We forgot that slide. Sorry. Which employers provide insurance? And when we get to the insurance section, I'm sure that Mark Pauly is going to talk about why it's more likely that big insurers provide insurance and small employers don't provide insurance. It has all to do with what the costs are for them. We will make sure Mark at least addresses that. We got a state program to provide insurance for people who are uninsured and poor. It's called Medicaid, or CHIP for children. We know that we're not enrolling 100% of the people. As a matter of fact, we enroll closer to 50%. I don't know the exact number off the top of my head. That's an assignment for all of you smart Penn students. What proportion of people who are eligible for Medicaid do not enroll? But it's south of 70%, I can tell you that. Why is that the case? There are multiple reasons. Okay, so one way states intentionally keep their Medicaid rolls down is to make it hard to enroll. You go down to a state, get their form for enrolling Medicaid, you're well educated, way over the average American, and certainly way over the uninsured average American, way over the poor average American. It is bloody hard to figure out those forms. Then you got to come down with 2 pieces of ID. And, by the way, we're going to make you do this regularly. You don't get on until you get off. It's either every 6 months or every 12 months. We're going to make you go through this eligibility process again, just to make sure you're not cheating us. So that's one reason. States have a variety of very creative mechanisms to discourage people for signing on for benefits that they are legally entitled to. Medicaid is the biggest one where they put in a lot of barriers. And that's because it's expensive for them. What's another reason? Yeah. It's not so easy to target. So if you're a welfare rights group or a group that really cares about this population and you want to get them insured, it can be somewhat difficult to get them onto the rolls. What else? Yeah. Right, you might not realize. In addition, look, we are in the United States of America. Whatever else you think about the United States of America, we still believe somewhere in our brain in self-reliance. And there is a good portion of the population that finds it embarrassing, offensive, to get government handouts, even if they need it. They don't want to be on welfare or Medicaid or food stamps. And we have made it stigmatized. Medicare, not stigmatized. Why? Everyone gets it, rich and poor. We're all in it together. I'm not signaling myself out as some poor schmuck who can't get a job by going on Medicare. I just happen to be 65. On the other hand, if I get Medicaid, I got like a big A, on my chest, the scarlet letter. We made it that way. We didn't have to make it that way. Last reason. Look, we're in the land of America. What do most Americans believe, even if it's false? Tomorrow, it's going to be better. I'm not going through all that hassle signing up for Medicaid. I'm going to get a job in a month. I don't need it. So there is this triple factor. One is, I don't want to be embarrassed. I don't want to take the handout. I don't want to be singled out and stigmatized. Another is, things are going to turn around for me. You know the group who thinks things are going to turn around for them most in American society? Highest group, African Americans. Most optimistic about things getting better. Go figure. And then the last one is, even when someone goes in, we make it bloody hard for them. We want to discourage them, right? They don't pass these restrictive, complex forms saying we're trying to discourage people, but they know plenty well what they're doing. I thought it would be useful for you to see. Unfortunately, we don't have the percentages here. I don't know what ended up happening. Sorry. It's what happens when you do the maiden voyage of a course. But you can see some of us really care about children, how children break down. The vast majority, not the vast, a majority of children get coverage through employer and mom and dad. But a sizable fraction, round about 40%, get coverage through Medicaid and CHIP. Okay? It's a very big percentage of the population of children get their coverage through Medicaid and CHIP. All right. I am not going to spend a lot of time on this fact, but being uninsured, you might hear from, again, some of your Neanderthal relatives who come over for Christmas or Thanksgiving. Well, it's not so bad. The people who are uninsured, they're 19 to 29. A lot of them are working. Has no real impact on health care. Well, first of all, psychologically, it's not good to be without insurance. It takes a toll, worrying that if you got sick, you don't have a safety net there, and you could be in bankruptcy, or you could not get the care you needed, or whatever. That's just not a good place to be. But the other side of it is, we have good data now that if you're uninsured or you're on Medicaid, your health outcomes are bad. I'm an oncologist trained as a cancer doc, actually a breast cancer doc, and there are these data, which I have to say are one of the most disturbing data I have ever seen, that shows you if you got private insurance, your chance of surviving 5 years breast cancer, nearly 90%. I bet that was a data point most of you didn't know. Got diagnosed with breast cancer, 5 years later, 90% of the women are still alive. On the other hand, you got Medicaid or uninsured, your chance are 3/4. That's a 13% difference. There ain't no drug in breast cancer that makes a 13% difference. The best thing oncologists can do for their uninsured patients is get them insurance. Does a lot better job in improving their longevity than anything else. That is a very big difference. That's a hard data point. It's not a made-up data point. It's not subjective feeling. Do you feel better in the morning? It's not psychological. It's life or death.